Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. Many of us in the healthcare field have heard the term vasovagal, and it's common when procedures are done in people or if they have severe pain that they have a reaction called vasovagal where all of a sudden the person can say, I don't feel good, I feel like I'm going to throw up. They get clammy, their blood pressure goes down, pulse goes down, and that's when I or any other doctor who's done a procedure on somebody would rush into the room, because if the blood pressure gets too low or the heart rate gets too low, that can be extremely dangerous. So normally what occurs then is the person is told to lay down, elevate the feet, splash water on the face, and just see very quickly if the blood pressure and pulse rate can go up. And sometimes you have to put in an IV, and even there are even times where you have to give atropine or a medication that will block the vagal impulses from going into the body, so it raises the pulse rate and often the blood pressure. So today I want to go through not exactly vasovagal, but one of the reflexes in the body called the trigeminal cardiac reflex or trigeminal cardiac reflex, TCR, which explains how you can get too much vagal tone. Many of my videos, I talk about vagus nerve degeneration. We'll even talk about that here because I believe sometimes even vagus nerve degeneration can cause vagus nerve dysfunction, and in some instances there can be too much vagal tone. I wanted to read some text from a local cardiologist to me. So these are just some of them, because it'll explain that most patients who have bradycardia, and that's what we're going to talk a lot about. Bradycardia is when the pulse rate's under 60. So some people have syncope or dizziness or fainting because their heart rate for some reason goes too low. And if you were having kind of a dysrhythmia or arrhythmia and your heart rate was going low and you were getting dizzy and fainting, you would probably go see a cardiologist. And the cardiologist's job is to see, is there some problem with the heart? So they'll normally order an echocardiogram and just see how are the chambers of the heart? How are the valves working? Is there an intrinsic heart problem? And if there isn't, then you think like, well, maybe it's the electrical input to the heart or the electrical circuits within the heart. So the vagus nerve, as we all know, or if you're new to this, the vagus nerve slows everything down. Slows digestion down, slows the heart rate down. So when I was in peak shape, having done 5 Ironmans, I might have had a resting heart rate of 52, because my vagal tone was so high. So I'm just going to read some of the text, and you'll get the point that bradycardia or vasovagal is actually very common, and most of the time the cardiologist says there's nothing wrong with your heart, it's something else. I'll go send you to the neurologist, or this cardiologist sends the patient to the prolotherapist, because if it's a primarily vagus nerve issue and the vagus nerve runs right in front of the cervical vertebrae, then changes in the cervical curve, specifically breakdown of the cervical curve from ligamentous cervical injury, then can cause problems with the trigeminal cardiac reflex or symptoms from vasovagal. So hey Ross, saw a patient with vasovagal syncope, fairly recurrent despite normal treatment. She also has hyperhidrosis or sweating, severe intense sweating of her hands, cold extremity. I think she has an imbalance of her sympathetic and parasympathetic nervous system. I'm going to rule out any cardiac issues, but I don't think she has them. And basically goes on to say, I think she has autonomic dysfunction, and she should come and see you to see if she has cervical instability or cervical dysstructure. So again, too much vagal tone. So somebody had diarrhea, somebody had extremely low heart rate, excessive sweating all over the body, episodes of low blood pressure, you might think, oh, there's vagus nerve dysfunction, so maybe it might be related to ligamentous cervical instability. So let me read. I have another young lady who's 22 years old that has severe autonomic dysfunction causing vasovagal syncope. She has a normal echo, normal stress test. She's hypertensive, but I think she's having like 10 to 15 episodes of vasovagal syncope a day. So he's gonna send her here. In the office, I've had young people, really young people who, because they couldn't find the cause of the bradycardia, and when the heart rate starts getting in the 30s, it's extremely, extremely dangerous. Because, obviously if the heart isn't pumping, the person can have catastrophic problems, even death. So there's been patients who've had pacemakers placed, and even young people, in their 20s or 30s that have come to Caring Medical. I've had just very interesting cases. I had one case where the person had an elongated styloid, so the patient didn't realize when they went like this or they turned, the styloid hit the vagus nerve, and then they would get bradycardia. And so they're getting their styloids removed, and I'm sure they're going to do great. So let's just talk about the trigeminal cardiac reflex, very, very important. This basically, when this is too active, you get sudden onset of bradycardia and hypotension, can be life-threatening when trigeminal sensory branch is stimulated. The trigeminal nerve is cranial nerve 5. It handles sensation of the face, the lips, tongue, eyeballs. So when those sensory branches are stimulated, you can have an excessive stimulation of the trigeminal cardiac reflex, and through the vagus nerve then you get bradycardia, or slowing of the heart rate, and hypotensive. So if you've been diagnosed with bradycardia and nobody can figure out the cause, this video I think is going to give you some answers. It's caused by parasympathetic dysrhythmias and associated with other potential symptoms including gastric hypermobility and apnea. So it can cause the breathing, difficulty breathing, and the vagus nerve, when it's stimulated too much, the person has hypermotility, so they can get cramping, really bad cramping. They can eat something and then immediately they get bloating of their stomach, like immediately, and obviously could get diarrhea. It's possibly a cause of sudden adult death syndrome and other serious life-threatening cardiac conditions. So eye doctors and like lung cancer doctors really know about this, because a doctor could be pulling on the eyeball. Remember, the eye sensation is the trigeminal nerve, so they have to be ready that any stimulation of the trigeminal nerve can give an excessive reflex, and all of a sudden the blood pressure can plummet out. And when you do various surgeries, you can be stimulating the vagus nerve, and that can give you this trigeminal cardiac reflex. The reflex arc is sensory stimulation of the trigeminal nerve through the Gasserian ganglion to the sensory nucleus of the trigeminal nerve, which is on the fourth ventricle by the pons. These then connect to the nucleus ambiguus and the dorsal motor nucleus of the vagus nerve. Those are in the medulla, which then activates the cardioinhibitory parasympathetic vagal neurons, which leads to the clinical symptoms of, severe dizziness, like I'm going to pass out. So we see here you have the vagus nerve, the cardioinhibitory center in the medulla, and that goes to the heart to slow the heart rate down. So Hauser's law, as I've said before, is when you have a symptom or you've been diagnosed with a certain condition and nobody knows the cause, if you follow the neurology will lead to ligamentous joint instability. So there's bradycardia, which involves the heart. So the nerve that does that is the vagus nerve. And if you follow it up, the vagus nerve runs right anterior, literally on the anterior cervical vertebrae, all the way up to the brainstem. So if you or somebody you know who has severe bradycardia has a reversal of the neck curve, well, the neck curve is supposed to go this way, so there's supposed to be a lot of room here. But if the neck curve goes reversed, what's encroached upon is the vagus nerve, and that can damage the vagus nerve, so you get dysregulation of the vagus nerve. And this just shows all the muscles that the trigeminal nerve innervates, so it's the muscles of chewing. Like I had a patient recently who said, I touch my nose and then all of a sudden I get tinnitus in my left ear, or the tinnitus gets much, much worse. So in other words, stimulating the trigeminal nerve causes a symptom. So somebody could blow their nose, right, and that cause heart problems, digestive problems. That would be through the trigeminal cardiac reflex. And again, the trigeminal nerve is sensory on the face, and it goes to the tongue, even the sensory part of the tongue, not taste. So somebody could drink hot tea and then all of a sudden they get dizzy. Well, why would hot tea cause somebody to be dizzy? Well, the vagus nerve isn't functioning right because of conditions such as cervical dysstructure, and then through the trigeminal cardiac reflex, the vagus nerve is stimulated, then all of a sudden they get dizzy. And remember, the vagus nerve goes all over, including the heart, the lungs, the kidneys, the spleen, the liver, the stomach, the pancreas. So somebody who they wear contacts and they put in the contacts, or the contact is bothering them, then all of a sudden they get dizzy. It can be through the trigeminal cardiac reflex. So they're stimulating the eye, they're rubbing their eye, that stimulates the trigeminal nerve. It connects with the vagus, and all of a sudden the vagus is stimulated, and then all of a sudden they get dizzy, they're gonna faint, they might have all of a sudden have diarrhea, they might even have trouble breathing. So again, the vagus nerve slows the heart rate down, and then if the vagus nerve is stimulated too much, you get vasodilation of arteries, and that vasodilation of arteries lowers the blood pressure. These are the three branches of the trigeminal nerve. The ophthalmic branch innervates the skin here, maxillary branch here, and the mandibular branch here. Then the trigeminal stimulation of the neurons goes into the brainstem. Then there's internuncial neurons, which then connect with the vagus nerve, and then the vagus nerve goes to the heart. So this is a good illustration of the trigeminal cardiac reflex pathway. So I hope that's clear. Stimulate the trigeminal nerve somewhere. Eventually it goes into the brainstem. The brainstem neurons in there connect to the vagus. Then the person gets vagal stimulation of the heart. So all of a sudden the pulse rate slows down, and then they can get dizzy. This just explains other pathways that if you stimulate the trigeminal nerve, it might affect other things. It might affect the spleen, the gastric motility, like I said, vasodilation, breathing, heart rate. And this is kind of all the different trigeminal reflexes. We're talking about the trigeminal cardiac reflex. There's the nasopharyngeal reflex, where you stimulate the nose, like you could be blowing your nose, like I said, and then all of a sudden there's a reflex where ultimately you have trouble breathing. Usually the blood pressure goes down. Some of them the blood pressure goes up. But seeing all of them, because of the vagus nerve, the heart rate goes down. Ocular cardiac reflex, again, physical stimulation of the eye, then the heart rate goes down. What I'm trying to educate you guys on is, when did this all start? You know, when did this all start? Obviously, if it started after a head trauma or a neck injury, like maybe a person got too forceful of a manipulation, or if they were cracking their neck, or all of a sudden a person was a college student and they were bending down all the time, hours and hours of studying, which of course would change the cervical curve. Was it a car accident? Was it a fall? Like if it occurred 6 months, a year, 2 years later, it probably is related to it. And then, does the person who has bradycardia or fainting episodes, do they have evidence of cervical instability? Like, is there clicking, popping, grinding of the neck? Is there tension in the neck? Do you always feel like something's tight up here? And are there other signs and symptoms of cervical instability? Like we said, crunching, locking, giving way. Does the head feel too heavy on the neck? That's a sign of cervical instability. Is there headaches, tinnitus, ringing in the ears, vertigo? Are there other signs and symptoms? And unfortunately, it's happening to kids. And this is the process by which a ligamentous injury or looking down at a cell phone for hours and hours cause ligamentous cervical instability, which ultimately can cause vagus nerve dysfunction. It can also cause intracranial hypertension by obstructing the jugular vein. And it can even cause vasospasms. So the other effect on the heart can be vasospasms, where a person gets angina, a young person usually, and nobody knows why the artery and the hearts are in spasm. It can be from vagus nerve degeneration. And vagus nerve degeneration affects lots and lots of organs, and it can cause leaky gut, digestive problems, like I said, bloating, the pyloric valve, the various valves in the digestive tract, the gastroesophageal sphincter to not open and close normally, so a person can get pyloric stenosis, gastroesophageal reflex, ileocecal valve dysfunction leading to SIBO, small intestine bacterial overgrowth. Review the anatomy again, the sensors for blood pressure and the carotid sinus, and that's innervated by the glossopharyngeal nerve and vagus nerve. So the vagus nerve is involved with blood pressure control. And then this just shows that with vagus nerve stimulation, basically what can happen is you can get bradycardia. Like when they've been implanting vagus nerve stimulators for conditions such as intractable seizures or rheumatoid arthritis that's out of control, sometimes the vagus nerve stimulators, they stimulate the vagus nerve too much and cause what? Bradycardia, or the heart can stop. So it's well known that vagus nerve stimulation too much vagal tone can have catastrophic effects on the heart, including asystole or the heart stopping or bradycardia. And right now in the world, scientists are trying to figure out why is there such an increase of sudden adult death syndrome, and one of the potential causes is vagus nerve dysfunction. This is the autonomic nervous system. Basically, how does our autonomic nervous system stay in balance? And the two sides of it are the sympathetic system and the parasympathetic. And about 90% of the parasympathetic, which is the part of the nervous system that has to do with peacefulness, calming, digestion, it's pretty much through the vagus nerve. And I liken the vagus nerve to the body's sensor. So if you think about it, what tells the brain what's going on in the heart, in your life, you feel safe, not safe, what's going on in your lungs, your digestive tract, your nutrition, it's basically through the vagus nerve. So if you get cervical instability, meaning there's too much motion of the cervical vertebrae because of ligamentous damage, it can affect the vagus nerve, which I call Cervicovagopathy. If you get too much SA node activity, because the right vagus nerve primarily goes to the SA node in the heart, the left vagus nerve goes to the AV node, you can end up with various arrhythmias, atrial flutter, fibrillation. Primarily on this, because we're talking about the Trigeminocardiac reflex, we're talking about bradycardia. And recently I've had a rash of cases where people have episodes of ventricular tachycardia. One of the patients, I think the person's in their 20s, they have a defibrillator implanted already, and we definitely found on them that there is a definite vagus nerve issue, and they had a horrible cervical curve. Again, the vagus nerve runs right in front of the atlas or C1. So a person who has a reversal of the curve. So if you look at here, here's the vagus nerve here. You could see where this person has a nice curve. This person has a reversal of the curve. That's normally what we find when people have bradycardia that's out of control, in and out of the ER because of various arrhythmias, ventricular tachycardia, atrial fibrillation where nobody knows the cause. When the heart structure is good, it's then the neurology that's screwed up, and it can get screwed up because there's injury to the ganglion of the vagus nerve. The ganglion of the vagus nerve sits primarily at C1, so if somebody had instability of the atlas or they had a reversal of the curve, that can encroach on the jugular and nodose ganglion. That's where the DNA of the vagus nerve is. So thus, the vagus nerve isn't going to function right. Sometimes it could function where there's too much activity and other times where there's too little activity. So what is a person to do? Well, start optimizing your neck curve. We just call this cervical curve correction. These are prism glasses. There's various cell phone holders they can put around your neck. Obviously, if you like looking down at your cell phone, do it with the neck extended. Make sure that the computer is high. Practice a looking up lifestyle. Even when you watch TV, make sure you're looking up. And then, there are times where we document instability of the neck by digital motion x-ray. And when instability of the neck is found, we utilize prolotherapy in the treatment of the neck instability. Typically, when there's bradycardia, we find that there's a pretty bad cervical curve causing multi-level cervical instability, but especially of the neck. So the process is many months of curve correction. So we give various exercises and figure out what sleeping position puts the vagus nerve under the least amount of stress. And if there's a TMJ problem, because the trigeminal nerve goes right near the TMJ, so if the person also has clicking, popping, grinding of the neck, we would utilize prolotherapy in the treatment of the TMJ. Once the cervical curve gets corrected and the cervical curve gets stability, generally what happens is the arrhythmias decrease, the syncopal episodes decrease, the heart rate starts going back into the normal range instead of having episodes like in the 40s, high 30s. The heart rate stays whatever is the person's baseline in the 60s, 70s. So I would just say that if somebody who's had syncopal episodes or severe bouts of bradycardia, please look into, is there cervical dysstructure or breakdown of the cervical curve? And is there instability? Get an evaluation for cervical instability. And if any of those are found, start cervical curve correction and get an evaluation for prolotherapy.